Hello, good morning, good morning, good morning. How are you? Long time. How are you guys doing today? It has been a very, very long time. Finally, I'm back. I'm back. I'm back to the online broadcast. How are you guys? I need all of you to show up. How are you guys to show up? It's nice to see you guys again, and it's nice to return back to uh, my usual weekend broadcast. Okay, it is nice to see you guys again once and for all. Thank you guys. It's been a long time. Uh, I miss all of you. For those that have been sending me greetings, I say thank you very much once again. It is nice to be back. Good morning, wherever you're watching me from. All right. Good afternoon or good evening, wherever you are watching me from. It is nice to be back again to continue where we stopped last time. I hope you guys are doing fine. All right. Please indicate where you are watching me from. Kindly indicate where you are watching me from. Tell me where you are watching me from. I'd like to know where you are watching me from. If you don't mind. Okay. Uh, let's wait a little bit. I'm going to wait a little bit for everybody to come online and then we can then start. I would like to hear from you guys. What have you guys been doing for the past month plus that I'm not online? I want to know what you guys are up to. Okay, so let's indicate where you are watching me from. If you don't mind, we're gonna just wait a little bit for everybody to come online, and then we can now start the program officially. Today, I'm going to be discussing about how managing hyperglycemia in people with type 2 diabetes. So that is what I'll be talking today. I shall be discussing uh, hyperglycemia in type 2 diabetics, how to manage hyperglycemia with people living with type 2 diabetics. We all know what is hypoglycemia. We all know what is hypoglycemia. All right. So let's exercise patience. Let everybody, I'm going to wait for everybody to come online and then we can now start the program. Meanwhile, I'll tell me where you guys are watching from. Just indicate where you are watching from so that I could give you a shout back. Okay. So let me just wait for about 5-10 minutes and then we can now start the program officially. Okay. It is good to see you guys once again. It's been a long time that I've been away on vacation. So finally, I'm back. Finally, I'm back. So I will be discussing hyperglycemia today. I'm waiting for everybody to come online and then we'll go now start. Today's topic is managing how to manage hypoglycemia in people living with diabetes. That is what I'll be discussing today. Meanwhile, if you guys have any question, shoot it across to me, and then I will deal with it while waiting for everybody to come online. Yep. Okay, we all know what is hypoglycemia. Remember, we have hyperglycemia and we have hypoglycemia. Okay, these are all medical terms. Okay, we have hyperglycemia and we have hypoglycemia. All right. So, what is hyperglycemia? It's a medical term. We have hypo and we have hyper. When you are living with diabetics and the doctor says you are having hyperglycemia, it means you are dealing with high blood sugar. That is what you are dealing with. It means your sugar level, you are dealing with persistent over elevated high blood sugar in your bloodstream. That means all the time your sugar level is above the normal level. So that is why it is called hyperglycemia. Then in the event the doctor say you are suffering from hypoglycemia, it means your sugar level, you are always struggling to bring your sugar level up to the normal level. Your sugar level is always below the normal level. So that is when it becomes hypoglycemia. So hyper means your sugar level is always high above the normal level, and then hypoglycemia means your sugar level is below the normal level. So you have to differentiate the two. What is hyper and what is hypo? So managing hypoglycemia in type 2 diabetics has a different, they are both similar, okay, between hypo and hyper. They are both similar, but they also have similar symptoms. But in managing it is in the way you manage hypoglycemia is different the way you manage hyperglycemia. Because if you are struggling to to bring down your sugar level to the normal level, you also be struggling to keep up your sugar level to the normal level because the sugar level is always below the normal level. Okay, so that is why you have to learn how to manage hypoglycemia in people with type 2 diabetics. It is very important. You can develop high blood sugar, which is hypoglycemia with type 2 diabetics. This may even mean you need to work with your doctor to update your diabetes care plan. So anytime you are having a hyperglycemia, your doctor is going to devise a plan in treating your diabetes. Okay. Every doctor has an individual has a different way of treating diabetes. So if Doctor A has a patient that is suffering from hyperglycemia, and we have Doctor B treating another patient with the same ailment, they might have different method of treating each individual diabetics, but may be arriving at the same conclusion. So don't be disturbed. Maybe you have a friend that is having a diabetics, and then he has a different medication or different care plan, different from what you are doing. Do not copy each other. Your doctor knows your history, your health history. That is why he fashioned out a plan for you on how to manage your diabetics. So every doctor has a different way of treating diabetics or taking care of their patients. It's going to be different from each individual. So do not take it anything serious when you see a friend of you having a different way of treating his or her diabetes differs from yours. Your doctor knows best why he fashioned out that plan of treating your diabetics. Okay. All right. So when you have type 2 diabetics, you might be experiencing high blood sugar, that is hyperglycemia. So remember, hyperglycemia means when your sugar level uh, is when your sugar level is high. Okay, when it becomes hyper, it means you are struggling with persistent over elevated sugar level. Your sugar level is always very high. It is not within the normal level. That is when you are having a hyperglycemia. So with diabetics, your body either doesn't make enough insulin or can use it as well as it should be. Diabetes is a chronic long-term illness, health condition that affects how your body turns blood, food into energy. Okay, so you have to understand. Okay, you have to understand that your body breaks down most of the food you eat into sugar, glucose, and release it into your bloodstream. So once you are diagnosed to have hyperglycemia, then everything changes from starting from what you consume, what time you eat it, and what portion you eat it. Because now you have to learn how to count your carbs in order not to have persistent high blood sugar. So then you go to once you are having that issue, you now everything around you have to change. in terms of what you consume, when you consume, amount you consume, everything have to be taken into considerations. And then you are going to do away with eating all these sugary items. Okay? If you're used of taking sugar, you're going to stop it. If you're used of taking pop that contains a lot of sugar, you're going to change. So everything about you have to change. That is the problem of hyperglycemia. Okay? So that is one thing. So I have differentiate between hyper and hypo. Hyper means you are struggling with over elevated sugar level. Your sugar level is always very high. Okay? Your sugar level is always very high. Then when you are dealing with hypo, it means your sugar level is below the normal level. So one is hypoglycemia and the other one is hyperglycemia because your sugar level is above the normal level all the time. And then hypo means your sugar level is below the normal level. So you are now struggling to bring up your sugar level up. And then the other one, when your sugar level is up above the normal level, you have to bring down your sugar level back to the normal level. Okay. So unlike type 1 diabetes, in which your body doesn't produce insulin at all, type 2 involves insulin resistance and then abnormal insulin release in your body, which may contribute to hypoglycemia. Okay. So type 2 diabetes, you are struggling with insulin resistance. In type 1 diabetes, you are not struggling with insulin resistance. They're two different things. Okay. And then too much of insulin production in your body is not good enough. You have an adverse effect if your body is producing too much insulin that your body doesn't need. I'm going to discuss that issue another time. When your body is producing more than enough insulin in your body and dumping into your system, it has an adverse effect. And that is why you got to be very careful when your body is producing over and over enough insulin that your body doesn't need. And that these are all the reasons why you are diabetic. All right. So now remember, um, what did I say? I'm gonna just update you guys with this. Just if you guys have any question, please, I need kindly ask me question while I'm kindly ask me question. Um, Eric, how are you? Welcome back, please. Yes, thank you, Eric. Eric, how are you? I'm back. Thank you very much. How is you've not well, I know it's your privacy. You've not updated me about your son. How far about your son, Eric? It's been a long time about your son. How far is he doing? I hope he's doing better. I hope he's doing better, Eric. Okay. If you guys have any question, feel free to ask me. All right. Um, Now, I was trying to say something before I interjected. Okay, I say unlike type 1 diabetics, in which your body does not produce insulin at all, type 2 involves insulin resistance and abnormal insulin release in your body, which may contribute to hyperglycemia. Okay, so I'm trying to differentiate between hypo and hyper and type 1 diabetes and type 2 diabetes. So you're going to know the differences. Okay, once you identify that you have type 2 diabetes, which is hypoglycemia, then you are struggling to control your sugar level, bring it back to normal. Then once you are having hypoglycemia, it means you are struggling to bring your sugar level up to normal. So you have to learn how to differentiate the two. One does not produce insulin at all. The other one has an insulin resistance. Okay, and when you have insulin resistance, there are two things that are occurring. It's either the insulin in your body is abnormal, it's producing too much insulin that your body needs, or it's not even producing enough insulin that your body needs. So when you have abnormal insulin release in your body, it has an adverse effect. If your pancreas is producing more than enough insulin that your body needs and dumping all the insulin in your body, it has its own adverse effect. Now, if your pancreas is producing less insulin that your body needs to control your sugar level, then you are having that type 2 diabetes. That is why your sugar level is now piling up, that it becomes abnormal. Okay. So once you identify the type of diabetes you have, first of all, identify the type of are you type 1 or type 2 diabetes? If you're type 2 diabetes, then is it hypo or hyper? So you're going to break them down. If it is hyper, then now I'm struggling to control my sugar level. My sugar level is always very high. What am I doing that my sugar level is always very high? Because now my pancreas is not producing enough insulin that my body needs to control the sugar level, or it's producing more than enough that my body needs, but it doesn't know how to use it effectively to control the sugar level. Now you have to figure out, what am I doing right or wrong that my sugar level is now very high. Remember, there are consequences if you're not treating that high blood sugar in your bloodstream. Okay, so don't just ignore it. It's okay, yes, my sugar level is very high, it's going to come back down naturally. No, you have to do something by yourself, by seeing your doctor, be on medication, involving exercise, balancing your diet in order to control that sugar level, to bring it down to normal. Leaving it there where it is, that the sugar level is piling up in your bloodstream, has an adverse effect to other organs of your body. We've discussed that several times about the consequences of having too much too much sugar in your bloodstream. Okay, so you have to take serious about it. When you have too much sugar in your bloodstream, you have to find a way to bring it down. Now, if your sugar level is below the normal level, now there are other symptoms that comes with it. You're now struggling how to bring up your sugar level up. Okay, so you got to differentiate between the two. We're having other. Connie, you're welcome. How are you? How are you? Thank you, Eric. All right, no problem. Thank you. Thank you very much. Let's go back to what we were discussing. So, what are the symptoms of hyperglycemia? First of all, what is considered hyperglycemia in type 2 diabetes? Okay, let's understand what is considered hypoglycemia in type 2 diabetes. Okay, normal is 99 milligram per deciliter. Okay, or lower. So now, if your blood sugar level is 99 milligram per deciliter or lower, then that you're okay. Then pre-diabetics is 100 to 125 milligram per deciliter. So when your sugar level is between 100 to 125 milligram per deciliter, you are on borderline diabetes, which is called pre-diabetes. Now, if your sugar level is at 99 milligram per deciliter or lower, that means your sugar level is okay. Now, it becomes diabetic when your sugar level is between 126 milligram or higher. Okay, okay. So you become diabetic when your sugar level is 126 milligram or deciliter or higher. Hyperglycemia is 130 milligram or higher than 180 milligram 2 hours after eating. Okay, so you have your normal sugar reading, you have pre-diabetics reading, you have it when it becomes diabetics, and then when it becomes hyperglycemia. Okay, remember, you will say, okay, somebody's going to ask me a question now. Why do I say diabetics is 126 milligram per deciliter or higher, and then hyperglycemia, which is uh, higher than 130 milligram per deciliter or 180 milligram per day after 2 hours of eating? Because if you're diabetics, it means your sugar level is already high. Let me differentiate the two. Why I said hyperglycemia higher than 130 milligram per deciliter or higher than 180 milligram per deciliter 2 hours after eating. And then you have diabetes, which is 126 milligram per deciliter. Now, if your sugar level is, if your sugar level in your bloodstream is 126 milligram per deciliter, it becomes confirmed diabetes. You're not becoming a diabetic. There's nothing you can do, man. You cannot cure it. What you have to know is how to manage it. Then when it gets to 130 milligram per deciliter or 180 milligram per deciliter 2 hours after it becomes hyperglycemia. Now, 126 milligram per deciliter, it becomes diabetics. The question now, the doctor is going to find out what type of diabetics are you? Are you hypoglycemia or are you hyperglycemia? Type 1 or type 2 diabetics? Because remember, diabetics is one word. But when you break down diabetics, you're going to find out, are you type 1, are you type 2, or hypo or hyper? Because if you tell somebody I'm diabetic, they're going to ask you, what type of diabetes are you? Are you type 1 or type 2? Then the person is going to try to figure out the kind of diabetics you are. So diabetics in general, you become diabetic when you have 126 milligram per deciliter or higher. Now, the question now I'm going to try to find out, are you hyper or hypo? I'm going to look at the numbers to know. You can be diabetics and have type 1 diabetics. Your sugar level is always below the normal level. You can be diabetics and have abnormal sugar level. Your sugar level is always very high. So when I have to look at the numbers in order to identify which classification should I give you. Are you hypo or hyper? So when I look at the numbers and I see that your sugar reading is 130 milligram per deciliter or 180 milligram per deciliter 2 hours after eating, then I can conclude that you are hyperglycemia. It means your sugar level have shoots too high that it is too much. You have to bring it down. Now, if it is go below, if the numbers read below 126 milligram per deciliter or below 130 milligram per deciliter, I can now conclude, okay, you are hypo because you are now struggling to bring up your sugar level up. So that is why you see I include hypoglycemia number and I include diabetics number, because the normal sugar reading for a healthy individual is 99 milligram per deciliter or lower than that. Now you become a borderline diabetic, which is pre-diabetics, at 100 to 125 milligram per deciliter. That is when the amber light is flashing. That is when the warning light is flashing. That, hey, listen, you have only one chance now to reverse it back. Because once it crosses that pre-diabetes and you enter the range of diabetes, it can never be reversed and it can never be cured. So when the amber light is flashing at 100 and 125 milligram per deciliter, you are on a borderline pre-diabetes. That is when you have a chance to reverse that trend back for you not to be diabetic. Now, if you did not catch it in time and it goes to 126 milligram per deciliter or higher, then that means you are not confirmed diabetics. Now, the question now the doctor is going to find out, looking at the numbers before him or her, is, are you hyper or hypo? Are you type 1 or type 2 diabetics? The numbers are going to say where to classify you. So if your number is higher than 130 milligram per deciliter or 180 milligram per deciliter after 2 hours of eating, then the doctor can now authoritatively say, look, listen, you are suffering from hyperglycemia because of the numbers in front of me. So I hope you guys are getting it. Okay. Now let's talk about the symptoms of hypoglycemia. We're going to talk about the symptoms of hypoglycemia. Olubimi, how are you? I'm good. Thank you very much, Olubimi. How are you? Long time. All right. So, if you guys have any question, do not forget to ask me. Okay. So let's look at symptoms of hypoglycemia. Hyperglycemia. Sorry about that. What are the symptoms of hyperglycemia? Let's talk about the symptoms of hyperglycemia. Now, these are the symptoms of hyperglycemia. You can see it on the screen. These are the symptoms of hyperglycemia. The symptoms of high blood sugar include excessive thirst. Okay, when you're having the excessive thirst, you're drinking a lot of water. Okay, uh, frequent urination. The second one is sorry, I didn't put a comma. I'm going to just I didn't put a comma in between the line. Okay, the first symptoms of high blood sugar include excessive thirst, which is number one. Just mark it as number one. Number two is frequent urination. Number two is frequent urination. That's number two. I did not put comma, so I'm trying to separate it so you guys can understand. Number two is frequent urination. And number three is when you are having a smelling breath. When your breath is smelling. That's number three, a smelling, fruity smelling breath. And the number four is the popular one, which everybody knows is blurred vision or changes in your vision. Blurred vision is what is prevalent. That is one of the symptoms that you can notice very fast. So number four is blurred vision or changes in your vision. Okay. Number five is slow healing of wounds. When your wounds are not healing properly and on time, okay, it means you are diabetics, because once you are diabetics, your white blood cells, your defense mechanisms are weaker. So that is why you have been advised as a diabetic to avoid any cut, any blisters, any wound. Because if you're a diabetic and you have wound, one, it doesn't heal in time. It takes a longer period of time to heal. And if care is not taken, if there's an infection through that wound, that's when your bigger problems start. That might lead to an amputation of any of your limb, leg, or hands. So that is why you've been advised, if you're diabetics, avoid blisters, avoid wound, anything cut, anything that is going to expose your blood cells, your white blood cells, to avoid any infections. Okay, but if you are controlling your blood sugar levels constantly, that your sugar level is in the normal range, if you have wound, it's going to heal properly. Okay, once your sugar level, you are consistently maintaining your sugar level at a normal range, and you have wounds, your blood sugar, I mean, your wound are going to heal properly. 1, 2, 3, 4, 5, 6. The number 6 one is fatigue or lethargy. When you are fatigued, tiredness, weak, okay, that's number 6. And the number 7 that I'm not displaying here is unintentional weight loss. When you are losing weight that you cannot explain, those are the symptoms of high blood sugar in your bloodstream. Okay, those are the symptoms of high blood sugar in your bloodstream. I think I'm going to put it properly. Okay, I'm gonna put it properly for you guys to some of you might not know how to. Let me put it properly so that it's gonna be very easy to understand. Two, three. Okay, I put it this way. At least I put some numbers there. In number one include excessive thirst. Number two, frequent urination. Number three, frequent. Okay, so that makes it better. And then I'm gonna put the last one for you guys here to see. Number four by six. This is number five, number six, and number seven. Okay, so that's number five, number six, or number seven. So those are the symptoms of uh, Ruth. You are welcome. Lauren Mienga, you are welcome. Ruth, you are welcome. Ruth, you're welcome. Lauren, you are welcome. It's nice to see you guys. See you guys once again. It's been a long time that I've been away. And thanks for all the messages that I've been getting while I was away. So I do appreciate it. So we are talking about. I did show you guys the symptoms of. So we are the symptoms of hyperglycemia. As I said, is excessive thirst. Number two is frequent urination. Number three is smelling bread. And number four is blurry vision or change in vision in your vision. Those are the symptoms. All right. If you're having high blood sugar, which is hyperglycemia. Now, number five is slow healing of wounds or infection. Six, fatigue or lethargy, and seven, unintentional weight loss. As I said, number five is very important. In fact, all the symptoms are very important, but you got to be very careful of number five. If you're diabetic, you got to avoid anything wounds, anything cuts, anything that is going to expose your white blood cell. Anything that's going to expose your white blood cells, avoid it, because once you're diabetic, your defense mechanism in your body is weak. Your white blood cells are weak. So once you have any cut or injury, it takes a longer period of time to get healed. And if that wound is not healing properly because of the slowness of it, there's a possibility that you might get infections. And when infection penetrates through that wound, that becomes a very big problem for you. It might cause you to have an amputation to save your life or any of your limbs. So that is why it is being advised anybody that is diabetic to avoid falls. Anything that's going to make you to have wounds, expose your white blood cells, avoid it at all times. But if you are controlling your sugar level and in all the time, if you are having consistent controlling your sugar level all the time, if you have wounds, it's going to heal properly. Okay, it's going to heal properly. So that is one thing. So any questions? I'm open to any questions. Now let's go to how do you treat high blood sugar in type 2 diabetes? I've said it several times how to treat diabetics. If you're having type 2 diabetics or even type 1 diabetics, okay, let's All right. How do we treat type 2 diabetes? One is through medication. Lucky, you're welcome from South Africa. You're welcome to the program. Hope you're okay. So, how do we treat type 2 diabetes? How do you treat type 2 diabetes? One is through medication. Popularly, because if you're having type 2 diabetes, it's going to be through medication, either orally or insulin. Like now, before, if you have type 2 diabetics, you go, they give you oral medications. You might not, rarely do they give you insulin because insulin is mostly for type 1 diabetics, insulin injection. But now, while I was away, uh, tried to read something from the that came through the journal about insulin, using insulin for type 2 diabetics. So I have not grasped about it. I'm going to go through it later and know the circular. So there's something they circulated about insulin in treating type 2 diabetes. So I have not have fully grasp of it. I'm going to go through it. But on type 2 diabetics, mainly you are on oral medication. Now, you have choice. Your doctor can ask you, do you want to be on medication for a longer period of time, or do you want to control it naturally by exercise, dieting? Okay, you can be on medication to control your sugar level, and you might try to control it by yourself without being on medication. As I said, either way is okay. I have a lot of people, I have a lot of friends, I have a lot of patients that are not on medications. They control their sugar level through exercising and balancing their eating healthy food, and they control their sugar level. But that takes a lot of discipline. You must be disciplined in order to be out of medication and to control your diabetes with healthy eating and exercise. It's not exercise today and then in the next 3 weeks you're not going to go to exercise again. It's a consistent exercise. You have a plan and you have to follow that plan that you devise for yourself, that you must be physically exercising all the time. And then you must be eating healthy. And again, you must be reducing your weight. That takes a lot of discipline if you don't want to be on medication. Now, there are people that are on medication and also exercising. So it depends either way which is okay for you. So if you know you cannot control your sugar level with exercise, balancing your diet, eating healthy, reducing your weight, then it's advisable for you to be on medication. And then you cannot do exercise once in a while. But exercise is recommended for people with diabetes. So if you know you are not disciplined, then I would advise you to be on oral medication and then exercise and then eat healthy food. You got to watch what you have to eat. Know how to count your carbs. Okay, and then portion sizes. So one way of treating high blood sugar is medication combined with exercise, and then combined with healthy dieting, and then combined with reducing your weight. These are all the 4 programs you can manage your diabetes, type 2 diabetes. But as I said, if you know you cannot afford, because I know diabetes treatment, the medications are very, very expensive. Not everybody can afford treating diabetes because of the nature of the cost of treating it. So many people devise a means to go on dieting and physical exercising in order to control their sugar level. But it takes a lot of discipline. But if you can afford the medication, then you can be on oral medication and at the same time combining oral medication, exercising, reducing your weight, and eating a healthy food. All this must go hand in hand. You cannot be taking your medication and then you are eating the same food that causes you to be diabetic. No. Once you're taking your medication and you're diabetic, your dieting has to change. There are food that you can never eat again. Never eat again. And there are some food, even if you want to eat, you have to learn the portion size, at what time, intervals for you to eat. So that is now where we are going into managing diabetes. We've identified what hypoglycemia is, differentiate between hyper and hypo, type 1 and type 2 diabetics. We've talked about the symptoms of diabetics. We've talked about the numbers. What is the normal sugar range, pre-diabetics, diabetics, and hypoglycemia? Now is the managing diabetics. That is the treating it. Treating diabetes fall under management. It must go hand in hand. You're on oral medication, you're exercising, you're eating a healthy food, and then you are reducing your weight. All these four elements must go hand in hand. If you cannot afford a medication to treat your diabetes, then it's advisable for you to do what? Physical exercising, eating a healthy diet, and then reducing your weight. But you must be disciplined. Discipline has to be involved. Jabu Shongwe, you are welcome to today's program. You are welcome. Watching from Botswana, you are welcome. Okay. So now that is the element of treating type 2 diabetes. Oral medication, eating a healthy diet, you're going to change all those food you are eating before have to be cleared out. You have to learn portion control. You cannot be eating the large food that you used to eat before. No. Now you have to reduce the portion size. Remember why? The reason why you have to reduce the portion size is because of the carbs in it. If you understand the meaning of carbohydrate, then that is why you have to reduce your portion size. Because before you are eating one large meal at a go, and that large meal contains a lot of carbohydrate. Okay, and I've told you guys what carbohydrate is. You can be. Don't say because I stopped taking tea. Adding sugar to my tea or I'm no more drinking. Then you are okay. No, that carbohydrate is same thing as sugar. So that is why now you have to reduce your portion when you're diabetic to eat in a smaller quantity at an interval. Every 4 to 5 hours, you grab a smaller quantity at an interval because of the carbohydrate that is in it. Okay? So if you understand the carbs, if you understand what carbs is all about, that is why you have to eat in a smaller quantity. Okay? So many people with type 2 diabetes will be able to bring their blood sugar level down by drinking a lot of water. So you got to substitute drinking water. Those pop you are drinking, Coke, Fanta, all those non-jargons you are drinking, you got to stop it. You got to control your craving, your sugary craving. You control it and drink a lot of water. You got to replace. You have to replace that. You have to replace that sugary item you are drinking with water. Okay, and increasing their exercise. As I said, exercise is very important. Exercise is very important. And I've told you guys what is exercise. Exercise is not when you go and register in a gym. There are some people that are in the rural villages. There's no gym in the rural villages. So that does not, when they say exercise, does not mean you have to go to the city and look for exercise. No. Do you know that farming you are doing is an exercise because you are expelling a lot of energy. You are burning a lot of carbohydrate. That farming you are doing is exercise. That cutting of grass is exercise. Taking a walk in the field is exercise. Okay, running, jogging is exercise. So it's not necessary that you have to go and register in a gym. Anything that is going to increase your heart rate beat is an exercise. Because anytime your body, you are doing, like you started running faster now, you see your heart rate is going to increase. Once you engage in any intense or physical activities, your heart rate is going to increase. So anything that is going to increase your heart rate beat a little bit is an exercise. Because once your heart rate is beating higher, your blood flow circulates, oxygen circulates, you breathe fast, you sweat. So it is not necessary you have to go and register in a gym. When you go and tilt in a farm, walking all the way from the going to taking a walk from your home to the market and back is exercise. Okay, going to the stream to go and fetch water and come back is a very intense exercise. So you have to be physically, you know, active. That is what the exercise they are talking about. Then if you're in the city, because of the congestions, okay, you can substitute using your car to go to the shop by walking to the shop. So if the shop you are going to walk is about 10 minutes away, park your car and walk to that shop and walk back. If the market is not far from your home, walk to the market, buy the thing and walk. Those are all physical exercise. So you got to drink, substitute, you got to substitute all those sugar items you are taking with water. Drink a lot of water, and again, increase your physical exercising. It's very important. You got to be physically active. Okay, so riding a bike, those are exercise. Okay, so when you are taking a walk, riding a bike, okay, jogging, cultivating a farmland, cutting a grass, walking on the staircase up and down, those are all physical exercise that is going to help you typically to lower your sugar level down. All right. So in conjunction of taking your medications, engage in physical activities. Okay, engage in physical activities is very important. Beverly, you are welcome, 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 welcome. Nice to see you back again, Beverly. You're welcome. All right. Welcome back, Beverly. Nice to see you guys again. Nice to see you guys again. Those that are sending me messages, I say thank you in advance. Thank you for all your messages. I read all your messages and I do appreciate it all. All right. So, so, so this is how you treat your diabetes. Okay. Now, let's. I have not seen any question. Nobody has asked me any question today. When I don't get any question, it means I'm happy. You guys are doing very well. It means you are taking care of your blood sugar levels. So that makes the job easy for me. All right. That makes the job easy for me once I don't have too much questions. All right. So we'll talk about exercise now. Uh, okay. Somebody send me something. I'm trying to read what it's all about. Yeah, I was saying when I came back, I have a cycle from the medical journal about insulin because in type 2 diabetes, we don't use insulin to treat type 2 diabetes. It's mainly for type 1 diabetics, the juvenile diabetics. Type 2 diabetes is more or less pill or physical exercise. But there is a circular about using insulin to treat type 2 diabetes. As I said, I don't have full knowledge all about it. I'm going to read it properly to understand what they are saying. So for that, I'm not going to go into it now because I don't have full grasp of it. Because I know it will have to in people with type 2 diabetes, less than 10% worldwide uses insulin to treat type 2 diabetes. So I don't know how it's going to work. As I said, I don't have the full knowledge about using insulin to treat type 2 diabetics. But there's something that just came out that I have to find out what it's all about. So we're going to discuss that some other time. All right. Somebody asked me on my WhatsApp, can you develop complication with type 2 diabetes? Yes, I've said it. Whether you have type 1 diabetes or type 2 diabetes, okay, you can develop complication. You can develop complication with type 2 diabetes. Doc, is it okay to take lemon water twice a day after breakfast and after breakfast? To answer your question, you are doing very good. I personally, I take lemon. I add lemon in my water. Any water that I drink. If I drink water 20 times a day, there's lemon in it. I'm just giving you an example. Physically, me. Okay. Despite my profession, I'm diabetic, but you hardly know that I'm diabetic because mine is controlled for over years now. But I've made it as part of myself. If I'm going to drink 20 cups of water in a day, there's lemon in it. I cannot drink ordinary water without putting lemon. Either the liquid lemon or I cut a slice of lemon, grab one in the fridge, put it in my water and drink. So I'm answering your question, Ruth. If I drink 20 cups of water in a day, that 20 cups of water contains lemon. So if I drink 10 cups of tea in a day, it contains lemon. So if if you are taking lemon consistently in your drinks, you are doing a very good job. It is good in managing your diabetes. It helps to lower your sugar level. It helps to keep your sugar level in check. So if you develop the habit of taking lemon in your drinks consistently, you are doing good in managing your diabetes. So as I said, it doesn't matter how many times you add lemon to your drinks. The question is, are you doing it adequately? Using myself an example, if I drink 20 cups of water in a day, there must be lemon in it. If I drink 5, 10 cups of tea in a day or hot water, boil hot water to drink it, just ordinary hot water, there is a lemon. If there is no lemon, there's apple cider. I always have, if I don't have lemon in my fridge, I have apple cider. One of these two, I have them at home, I have them in the office. So sometimes I mix both of them. I add a little bit of apple cider and lemon in my tea or in my water, and I drink it. But if you're going to take apple cider, make sure your apple cider is diluted. Don't take the raw one. The raw one is going to cause you a problem. It must be diluted that you can then consume. So, Ruth, to answer your question, it is not how many lemon you take in a day in your water. It is, are you doing it consistently? So anytime you want to drink water or you feel like taking hot tea, if there's a lemon close to you, put a lemon inside it. Lemon doesn't have any adverse effect. Whether you take it 20 times in a day, it doesn't cause you no harm. Right? Uh, so keep doing what you're doing. All right. That's good. So I've answered your question, Ruth. Um, I was trying to answer the question on my WhatsApp. Ruth, I hope I've answered your question. Doc, is it okay to use everyday pills as a form of family planning if you are diabetics? You don't have any problem. You don't have any problem if you are okay. Now, if you are diabetics, okay, and you are taking a pill every day as a form of family planning not to get pregnant, let me use for another word. It doesn't intervene in your diabetic medications. It doesn't intervene or cause, no, there's a word for it. Let me remember that word. You can, when I remember the word, I'm going to say it. Lorraine, you can take your everyday pill and at the same time take your diabetic medication. It does not cause you any harm. All right? Both are essential. There's a reason why you are taking your everyday pill as a sort of family planning. It does not affect or interject in your diabetes medication. Okay? So go ahead, do what you're doing, use your everyday pill, and at the same time, take your diabetic medication. It does not affect those diabetic medications. Okay? But once again, your doctor has a final say. Mine, I'm advising you, give you an opinion, but remember, your doctor has a final say on the medications you are taking. if you are taking any medications, if you're diabetes, okay, I've seen this warning before. If you're a diabetes and doctor put you on medication, if you are taking any other medication, let your doctor know that you are taking another medication. If once you're on diabetic medication and you go home, something happened, you can take painkiller. That's a different thing. Painkiller, you have a headache, slight headache, you take a painkiller. That's a different. But if you are going to take other medication that is going to be prescribed by a doctor and you are taking your diabetic medication, always go back to your doctor with that medication that you got somewhere and ask a doctor, can I take this medication in conjunction with my diabetes treatment? Always refer back to your doctor if you are going to be taking another medication. It is very, very important. On my own part, taking your everyday form pill and taking your diabetes medication is not a problem. Go ahead. But at the same time, I'm not going to overrule your doctor. Always ask your doctor, can you continue taking this medication in conjunction with your diabetic medication? Always refer back to your doctor. Why do I say that? Your doctor has your medical history, so he or she can advise you more than me that doesn't have your medical history. You are not my patient, so I don't have your medical history in front of me to judge whether you can take it or not to take it. But based on your question, I don't see any problem you taking your everyday family planning and then taking your diabetic medication. It will become a problem if you are taking your everyday pill for your family planning and you are not taking your diabetic medication. That is where I'm going to have a problem with you, Lorraine, because now you are prioritizing family planning over diabetics. And remember, that diabetics you are ignoring can cause a complication for your family planning. So first of all, you must first of all take control of your diabetic situation, control it for your family planning pill to work. So if you are taking your family planning pills every day and then you are not taking your diabetic medication, that is where I'm going to have a problem with you. Because now you are ignoring the essentials, something less essentials. Diabetes has a lot of complications. You can take as many pills, money family planning pill you can take. If you have a diabetic problem, you have too much sugar in your blood, abnormal sugar level, that can cause complication to that family planning you are trying to avoid. Okay? So for that family planning pill to work properly is for you to control your diabetes because diabetes can cause a lot of complications in your family planning. So make sure you are taking both of them at the same time. You take a family planning, you take a diabetic medication, all right? Then things are going to work out. So I hope I've answered Ruth's question and I hope I've answered Lorraine's question. More questions? Okay, let's deal with, while I'm waiting for other questions, let me deal with this question. Can you develop complication with type 2 diabetics? Lorraine, this is also part of the answer to your question. I've said type 2 diabetes has a lot of diabetes have a complications. It becomes you have a complications when you ignore the rules and regulation of diabetics. Remember, diabetics have guidelines, it have rules, it have regulation, it have norms that you must obey. It is not a choice. Once you're diabetics, now you must obey those norms, those rules, those regulations. It is never a choice. When you ignore those rules and norms of guiding diabetics, treating diabetics, that is when you are inviting those complications that might lead you to your death. So you must make sure that you obey those norms, those rules for diabetics in order to avoid those complications. Okay? So, and those complications have short and long-term effects, health complications. Now, let's look at, I've said it before, what are the complications? We've talked about retinopathy. I've done a lot of video about retinopathy. Okay, you guys know about retinopathy. If you check my videos, I've talked about retinopathy. What are the complications if you ignore treating your diabetes? You're going to have you wondered in your maybe let's concentrate in the African continent. Have you wondered in your family, you used to have an uncle Lucky, I'm going to answer your question. Just give me a little bit. I'm talking. I'm going to give you guys an example. In my family, I used to have a grandma. When I was a child, yes, when I was a child, she was never blind. Right from the time I knew her, she was my grandma. She was never blind until in her 70s, 80s. All of a sudden, she turned blindness. She turned blindness. That time I was a child. That time. It is now that I start remembering why all of a sudden she become blind. Because anytime we go on vacation, we go to the village. My parents will send me to the village to go and be with grandma. So I will leave the city and go to the village and help grandma to go to the market, teach the grand, go to the farm. African culture, when you're following your grandma, you go to carry the basket while your grandma carry the knife, and then you follow your grandma to the farm or to the market. African culture. So all of a sudden, I get back home one vacation. I see she turned blindness. She become blind. She can't even see. I thought she was joking. I can see her eyeballs, but she cannot see. I said, I thought she was, she was playing prank with me. I was a child that time. What am I saying? It is at this early stage that I start to figure out, okay, she was diabetic. And because she's in the village, I was a child that time. I think I was in the range of 10, 12 years old that time. And she was in her 70s that time. No, 60s, 70s, because she can still go to the farm and then go to the market. Then all of a sudden, she become blind. And I say, Grandma, are you joking? And she say, yeah, she become blind. It is now that I remember when I started growing up in the medical field that, okay, she was diabetic and she didn't know how to treat it. All of a sudden, that diabetic turned her to blindness. It later said they told me, yes, she was diabetic. And from becoming blind, I think she stayed for about another year, 2 years, and then she died. So what am I trying to say? If you ignore those complications, that is what is called retinopathy. If you ignore the complication of diabetes, there are stages of retinopathy complication that you're going to lose total, you're going to lose your eyesight, or you're going to be partially blind or total blind. So those are one of the complications if you ignore treating your diabetes. You might be seeing now, your blindness can come at any time. It doesn't give you any warning, it doesn't give you any sign. You can just be driving anywhere and all of a sudden you become blind. You can't see anymore. And that is it. So that is that retinopathy complications. I've done a little video on it. Vision changes, loss of vision. So if you don't treat your diabetes in time, you're going to have retinopathy issue. Going to cause it to cause blindness. We have a lot of it in Africa. You might have a gram from the story I just said. I know a lot of people in African country, my context will know that they have an uncle, sister, grandparent that they didn't want them blindness, but all of a sudden they turn blind and they don't know what makes them to blindness. But check to see if they are diabetics. Now, nerve damage. We're talking about nerve damage, the neuropathy. The nerve damage is, we know there's something they call diabetic feet. Neuropathy is the medical words. We call it nerve damage. So if you don't control your sugar level in time, you're going to experience those nerve damages. Burning sensation within your feet, around your feet, under your feet, on your ankles, those tingling of your toes, tingling of your finger, numbness of your toes. Now, once you start feeling those sensations, it means you are having nerve damage because your sugar level is elevated. It's too much. Once you bring down your sugar level back to normal, those nerve damage, those sensations, tingling, numbness, you see it disappears. Okay. So the other one is foot ulcer and lower leg amputations. That is a result that will come as a result of neuropathy, nerve damage. As I said, everything has stages. Once you're not controlling your sugar level and then you are consistently having those burning feet, burning sensation, tingling of your toes, numbness of your feet, your nerves are gradually being damaged. And now from stage 1, stage 2, stage 3, that's going to lead you to have that what's called foot ulcer or lower leg amputations. And I've told you guys what can cause you lower leg amputations if you have any wound in your feet, any slightest cut. Now, when your nerve damage is completely destroyed, that you don't have any feeling in your feet, okay? When you have nerve damage in your feet, completely, your nerves are completely dead. You don't have any feeling in your feet. and all of a sudden you have a cut in that feet, straight amputation, because now your white blood cells is no more function in that area. Your white blood cells, your defensive mechanism are all dead because of those nerve damage. So once you have any cut in any section of those feet, it's not going to heal properly. It's going to take a long time, and that is when amputation gets infection gets in, and then you get amputated. That is when you see some people, they get one of their leg amputated and they are diabetic because that nerve damage, they allow those nerve damage to be persistent. Persistent, they are not taking care of it, and then the nerve is completely damaged. And then all of a sudden, they have a wound in that area, and then they have to amputate in order to save their life. Okay, so those are the complications. Kidney damage. Okay, nephropathy. Okay, nephropathy is a kidney damage. It's one thing you're going to be say kidney and your liver is the two things you are going to guard against. Okay, it's two things you're going to guard against. Once you are newly diagnosed with diabetes, the first thing it attacks is your kidney and your liver. Okay, and if you can get hold of your kidney and your liver, it means you're not going to live long. Nobody is going to kidney or liver is not something you can get in the market to replace, and that's why I see a lot of people die quickly once their kidney is damaged due to diabetes complications. All right, heart disease, heart attack, and stroke. We've talked about that one. You know, when you hear about heart disease, you hear about heart attack and stroke. What am I talking about? I'm talking about high blood pressure and cholesterol. Okay, so you might be diabetics. For instance, you might not have any cholesterol issue now. You might not have any high blood pressure issue now. You're okay, but you become diabetics. If you don't control your diabetes situation, it's going to lead to high cholesterol, high blood pressure. Those are the complications. That's when you rarely see somebody that is diabetic that doesn't have cholesterol issue or high blood pressure, or three of them at the same time. Okay, so don't allow your diabetes to get out of hand. That is going to lead you to have cholesterol issues or high blood pressure issues, because it's going to lead you to all those three. That means you're going to be taking pills for the rest of your life. All right, then gum disease, around your teeth, your gum disease, decay, pain, removing your teeth all the time. When you start going to the dentist to remove your teeth all the time, within a year you remove 2 or 3 teeth, it means you have a problem. So if you are not diabetic already, and then you have removed two teeth within a year, within 6 months, that's a symptom that you are diabetic. So you have to go and check out to find out if you're diabetic, because you're going to have a gum disease, tooth decay. And then the last one is sexual dysfunctions. I've made a video about sexual dysfunctions, erectile dysfunction in men, and for women, loss of libido. Those are some of the complications that might arise from your not taking care of your type 2 diabetes. Okay. So now, let me answer this question from Lucky. Lucky says, why some people have unintentional weight loss while others are still maintaining their weight loss? All right. If you are losing weight and you cannot explain why you are losing weight, first thing you have to do is to go and see a doctor and talk to your doctor. Why am I losing weight? I cannot explain it. Your doctor is going to run a test to find out if you have diabetes or if you have any thyroid issue. Okay. Now, unintentional low weight loss. Remember, when you are diabetics, you are having frequent urination all the time. You are rushing to the washroom every seconds to go and urinate. You just went in now, all of a sudden you're going back again. Now, what happened is you have a high blood sugar in your bloodstream. Okay? So the sugar has gone so high, and then you are rushing to the washroom all the time. So what is happening is that the sugar level in your bloodstream, okay, there's a word I'm going to use. Your body is trying to filter all those high sugar level in your bloodstream. So in the process of filtering all those high blood sugar in your bloodstream through urination, the remaining liquid that is in your body is going along with it. So you're becoming dehydrated. So your body is not trying to filter the high blood sugar in your bloodstream. And at the same time, he's making your body to dry all the fluid in your body at the same time. So you are peeing too much. You are taking out the sugar level, and also you are losing a lot of fluid in your body. And because you are losing a lot of fluid in your body, in the process of filtering your sugar, the high blood sugar in your body, you are now losing weight. That is one. Two. Now, when you are diabetics, your blood sugar is fluctuating. It goes up and down. So within now it's going to be okay. The next thing is going to go high. The next thing is going to come down. Now, if your blood sugar is way down, your body becomes weak. Remember, your body doesn't store any more sugar in your body anymore. So because you are peeing everything out. Once everything goes, it pees it out. You're rushing to the washroom. You're losing fluid. You are filtering all the excess sugar level in your bloodstream is going out. Now you become weak. You become dizzy. Remember, that sugar is energy. It's like a fuel in the car. When you don't have fuel in the car, your car is not going to start. Now, when you become weak, because you are not losing a lot of fluid out of your system through urination, now your body has to go back because you are weak. Your body has to go back to your muscles. Because remember, your sugar is stored in your liver and stored in your muscles, tissues. So when your body, for instance, you are weak, there's no more sugar level in your bloodstream. What does your system? Your body goes back into your liver or into your cells to get some energy and releasing your bloodstream to give you more energy to do your work. That's why sometimes when you are weak, if you're diabetic, you start feeling dizziness. Okay, you want to find somewhere to stand. Your legs cannot carry you because your sugar level has dropped below the normal level. So you need something like sugar to bring your sugar level up. Now, in this event, all your sugar level has gone up because you are peeing oil every second. Now your body goes into your muscles, into your tissue, and then try to dig out all the extra sugar in your cells. There is none. So what does it do? Your body now turns and start consuming your cell tissues in order to supplement your energy. Because there's no more sugar level stored in your liver and in your cells. So your body have to find a way to keep you up. So what does it do? It goes and start consuming all your, eating all your muscle tissues in your cells to sustain you alive. So by doing that, you are losing weight. Okay, so that is why during the filtration, you are rushing to the washroom. A lot of fluid is going out of the body. The sugar is going out of the body. The fluid is going out of the body. Your body is not digging into your muscles to find extra energy to give you. That contributes for you to lose weight. If that is not the issue, your doctor is going to check about your thyroid function. There's a two thyroid gland on your neck here. It's going to check to see if you have overreactive thyroid or underreactive thyroid. If you're having overreactive thyroid, it's going to make you to lose a lot of weight until that thyroid issue is rectified. Okay, but the most important, they're going to check your sugar level and then check your thyroid organs to see if one is overreactive or two, the other one is underreactive thyroid issue. But most importantly, when that unexplained weight loss is because you are urinating all the time, frequently, and in the process of urinating, it's draining all the fluid in your body, it's draining all the sugar in your body. So now you don't have any more in your cells that's going to help you to aid you to be strong. So what happens? You start losing weight. Lucky, have I answered your question? Any more question? Any more question? Um, Um, Lucky. This is. I think I will. Lucky. I think. Okay. Any more question before we go? All right. Okay. So where are we now? Let's round up for today's program. We've talked about the symptoms, the complications, and I've talked about the complications. We talked about the symptoms. I have too many. I'm trying to select which. I have too many questions coming in here. I'm trying to select which question, which is more. I'm trying to select a question which is more. I can't answer all the time, all of the question. All right. Let's round up for today's program. So we all know what is hypoglycemia. We all know what is hypoglycemia. We all know what are the symptoms. We all know how to treat it. We all know the numbers to look out for, and we all know the complications. Okay, hyperglycemia, which is when you have too much high, when you're having a high blood sugar, is only common with people with type 2 diabetics. When you are struggling with your sugar level below the normal level, is called type 1 diabetes. That's where you find that situation whereby you are struggling to bring your sugar level up to the normal level. But when you are struggling to bring down your sugar level to a normal level, that is higher blood sugar level. You find those kind of issue with people with type 2 diabetes. Okay, the symptoms of high blood sugar or low blood sugar are similar. There are only one or two differences. If you list the symptoms of type 1 diabetes and the symptoms of type 2 diabetes, they're mostly similar. It's one or two differences. Okay. The way you treat type 1 diabetes and the way you treat type 2 diabetes, they're mostly similar. But the other one is type 1 diabetes is through injection, and then type 2 diabetes is through oral medications and then physical exercise. Okay. So what can I do to prevent weight loss? What can you do to prevent weight loss is manage your diabetes. Simple answer, Lucky, is what can you do to prevent weight loss is managing your diabetes. Once you are keeping your sugar level normal, let it be normal, you're going to take care of this weight loss. Remember, why you are having unexplained weight loss is because you are not managing your diabetes properly or your sugar level is too high. So the only way you can manage your prevent this weight loss is find out your diabetes. Okay, now I'm diabetic, and then manage it properly. And how do you manage it? Is to make sure your sugar level is at the normal range all the time. Okay, to make sure that your sugar level is at the normal range all the time. Okay. Another question. I'm trying to. So you got to make sure. So I'm reading. There's a question I'm reading here. Somebody sent me a question. I'm trying to make a sense of it, but I'm trying to read. Okay. So how to prevent weight loss is you got to manage your diabetes properly. Uh, well, how do you manage it properly is to keep your sugar level normal at all times. And how do you keep your sugar level at all times is to make sure you eat a balanced diet. Okay, make sure you take your medications. All right, make sure that you lose adequate weight. That is everything is in one word: managing your diabetes. So now the question you asked me is, so what can I do? He says, what can I do to prevent weight loss? And then uh, managing your diabetes is one, taking your medication, exercising, eating a healthy diet, and this includes food in high. Like you see what I put on the screen. This includes food in high in protein, such as meat, lean meat, not red meat, lean meat, fish, chicken, legumes, eggs, nut, and full cream dairy foods. Energy such as migraine, avocado, nut butters, oil, and salad dressing. Spread bread or cracker stick with avocado, cream cheese, peanut butter, or dip. The bread you go to take is brown bread. Okay, so these are some of the things. This one I put is your dieting. One is, you are diabetics. control your sugar level by taking your medication and physical activities. Make sure you're exercising properly and make sure you're eating healthy food. Make sure you balance your diet, okay? And then try to make sure you reduce your weight. If you're obese, you have to reduce your weight. If you're not obese, then you have to now eat a healthy diet. So the most important thing is managing your sugar level because your sugar level management was very poor. That is why you have unexplained weight loss. So now you have to manage your sugar level normal at all times. So once your sugar level is normal at all times, that is one by taking your medication and then exercising. One is managing your sugar level by oral medication, exercising, and then balancing your diet. And then if you can also find those food that I posted on the screen there, that can help you to prevent weight loss. But the most important thing is controlling your sugar level at all times. You must make sure that your sugar level is at 99 milligram per deciliter or less. Let me put that number back again. Okay, let me put that number back again. I think I put it earlier today. You gotta make sure your number is between 99 milligram per deciliter or lower. That's how you make sure your sugar level is at the normal range. Okay, Lucky, I hope I've answered your question in that aspect. Do we have any other question? I'm trying to round up for today. Do we have any other question? Do you have any other question before we round up? Okay, so you're welcome, Lucky. You're welcome. Yes, 90 millimole. I mean 90 milligram per deciliter, not million. Okay, you guys are using millimole. Yeah. Well, if you can come do the conversion, okay, I know you guys are in Africa. I'm using the North American standard here. Okay, but uh, if you can convert that 90 milligram per deciliter, is okay. Like 5.5 is fine. If your sugar level is between 5.5, that is better. Yeah, that is you guys are using millimole and we are using North American standard. That's okay. So if your sugar level is 5.5, 5, 5.5, 5.6, 5.7, 6, 4.5, within that range, it is okay. So root can yeah, root, yes, you're okay. 4.5, 4.6, 4.7 to 5.8 to 6. Once your sugar level is within that range, it's still fine. Even 6.1, 6.2 is okay. It is when it's above 7, that's when it becomes a problem. When it's above 7, that is when it becomes a problem. All right, so 5.5 root is okay. All right. Eric, I didn't see your question. You say you posted a Eric, you say you posted a question. I did not see your question, Eric. I'm trying to okay, 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 I've seen it. In my case, that my son's sugar level are able to drop without insulin now. Can we administer an oral medication like metformin? Uh, Doc, Eric, your son has a type 1 diabetes, okay? No, you cannot use metformin. Eric, can use metformin because your son, from what I know, your son is suffering from type 1 diabetes. The sugar level is always low. Okay, so now the sugar level drops below the normal level. You can't use metformin. Remember, metformin is used for type 2 diabetics. If your sugar level is too high, you bring it down. So you don't want your you don't want yours to drop more because metformin is type 2 diabetics. Okay, when your sugar level is high, you use metformin to control your sugar level to bring it down to normal. Now, because from what I know on your son's case is he is having type 1 diabetes, his sugar level is fluctuating, is dropping below the normal level. So you cannot use metformin to bring down the sugar level up. If the sugar level is higher, yes, you can use metformin to bring it down to normal level. But now that the sugar level is below the normal level, you can't use metformin to bring it down more. You need to use something to pump up your sugar level for your son to come up. So you have to get your sugar level for your son to come up to the normal level, not to go down more. So because your sugar level have dropped, you don't want it to drop more. Rather, you want to bring it up to normal level. So metformin cannot be used for that. Metformin type 2 diabetes to control high blood sugar to normal level. So instead of you using metformin, the insulin he's taking was to shoot up the sugar level to be at a normal level, to bring it to normal level. That's why when the sugar level drops, you give insulin to pump it up. Now, another way is practically when your sugar level drop, you need to bring it up. What do you have to do? You find something that contains a little bit of sugar to consume. Give it 15, 20 minutes, the sugar level is going to pump up to normal. So if you are struggling with type 1 diabetes, that the sugar level is dropping all the time, you need to eat something that's going to pump it up. That is why people with type 1 diabetes, juvenile diabetes, use insulin to control their sugar level to make sure their sugar level is always at normal. So metformin cannot work for your son because your son is suffering from type 1 diabetes. The sugar level is below the normal level. If it is type 2 diabetes that the sugar level is higher, yes, you can use it to bring it down to normal. But in this situation, your son's sugar level is dropping. You can't give it metformin to drop it more. It's gonna so metformin cannot work. Eric. All right. So Eric, to buttress what I just said, because I just I just checked the medical journal, and what I said is still correct. You know, so I just got this from medical journal. So what I just explained to you is still correct. So you can use metformin. Yes, metformin is initially intended for type 2 diabetes, not type 1 diabetes, but it is not off limit for people with type 1 diabetes. It can be helpful in several ways when taken along with your basal or bolus insulin. The benefit of metformin in type 1 that have been studied. So you can't use it. You can't use it for type 1 diabetes. It's for type 2 diabetes. But you can use it. You can use metformin for when you're using insulin, basal or bolus insulin. And why do you have to, if you're taking those insulin, why they want you to use metformin is those basal insulin will help to keep your sugar level of your son up to the normal level. Why the metformin is going to control the higher part of if your son's sugar level shoot higher. So if you are taking metformin and taking your basal insulin at the same time, both of them at the same time, the basal is going to act on keeping your son's sugar level to normal when it drops. While the metformin is going to act the opposite side. When your sugar level of your son goes above normal, your metformin is going to bring it back down to normal. So that is why you have to use both if you're going to use it in a rare occasion. Okay? Not all the time. So, but normally metformin is used for type 2 diabetes to control the sugar level. All right. So let's try to round up. So let's try to round up now. So I'm going to round up now because I've been here for an hour, 30 minutes. So tomorrow is going to be another day for us to continue. Tomorrow is going to be another day for us to continue. All right. I'm going to be online tomorrow and for us to continue another discussion. So I'm going to thank everybody that sent me a message while I was away to say thank you guys for the message you guys sent to me. And I'm going to thank all my fans that are here today and those that are watching offline. I say thank you guys very much. Send in your questions and I'm going to respond. Eric, send my greetings to your son and to your wife. I hope he gets better. If you have any other question, you have my WhatsApp. You can message me on my WhatsApp. Ruth, thank you guys very much. Lauren, thank you guys very much. For those that have sent in their questions, I say thank you guys very much. And do not forget to subscribe to my page. All right. And then try to share it. Okay. So once again, I'm going to say to you guys, let's do it some other time again. All right. So I'm going to let you guys be now and then see you guys some other time again. At tomorrow, I might be online tomorrow. Well, once I'm online, you guys are going to be notified that I'm online, so we can do this tomorrow again. Okay. So in the meantime, I say thank you guys for your time. Okay. Have a wonderful Saturday afternoon or evening, wherever you are watching me from. Let's meet tomorrow. Goodbye.